Hello, everyone. We are going to get started shortly. We're just waiting on folks to come on in. Gordon, Ryan, hello.
Am I in the right room?
You are, and we are live, just so you know.
Not a problem. Thank you.
Yeah, don't want to catch you off guard.
Christopher, I'm missing your chair, but it's good to see you.
Good to see you as well.
We are one shy of quorum at this time. I will do some text.
Austin, is this where we do the pro tem for Christopher?
Yeah,
Hey,
once
Sean.
we have enough folks for quorum and I take and Jaja, I will run the vote for you.
Thank you.
Of course.
I'm still working for the hospital, so thank you, Christopher.
Of course, our thoughts are with you, and hopefully your husband continues to get stronger.
Thank you so much.
Mm.
Perfect. And Okisha is here. Hi, Okisha.
Hello.
Awesome. Alrighty, members of the public, thank you for coming out. I'm going to be taking attendance, and due to circumstances, we're going to have an election for chair pro tem this time around. So first off, let's start with attendance. Member Anderson, member Caminos, member Carvalho, member Merritts, member McHenry Jr.,
Present.
member Patno, member Brandon,
Here.
member Reddy,
Present.
member Floyd,
Present.
member Ross,
Present.
member Watt,
Present.
member D.
Howdy, Mike D here. Thanks.
Thank you. And alternate Frutrell. Thought I saw
Here.
you. Did I see you, Marvin?
Yeah. Yes.
Sweet. Thank you. Okay, perfect. We do have all three members of lived experience, but thank you for showing up, Marvin. With that, we have a quorum set of 7. Thank you all for attendance. We do, as I said, due to circumstances, need to have a quick election for chair pro tem. Is there anybody that would like to make the motion? to elect.
I move,
I think
I
I move
make,
to
Christopher.
elect.
Well,
go ahead, Ryan.
thank you, Ryan.
I second.
And then is there a second? Thank you, Jaja. With that, all in favor, say aye.
Aye.
Is there
I
a discussion? Object, point of order.
There
Is
is
there
a
discussion?
I see Ben
yes, there is
Moritz in the,
discussion.
I see Ben Moritz in the public. Can you elevate him, please?
Oh, I think he came in and came out. Yes, Mike.
Thank you. I will be voting. Okay, so can you restate the motion, please?
The motion is to have Christopher Ross serve as chair pro tem for this meeting,
Thank you. I'll be voting no on
which
this
is
motion
authorized.
because I'm concerned that the implementation board's executive committee has overstepped their bounds, and Christopher Ross being one of the members of the executive committee for the implementation board, I would like them to hold off holding that position for today while we figure out what's going on with this and why they've overstepped their bounds. Thank you.
Thank you for discussion. Member Moritz?
Hey, thanks. Thanks everybody, and apologies for to Christopher for taking on the pro tem position again today. Mike, just real quick, I've been trying to get a hold of you so we could talk. I haven't been able to. If you just want to chat one-on-one some point, I'd love to do it. I'm sorry to have to extend the invitation publicly like this, but given that you have a lot of concerns, I'd love to address them with you. So maybe me, you, and Jaja can get together whenever is convenient for you. If you just send us a few times, we can get that scheduled.
Sounds great. I'm waiting for onboarding equipment and stuff from the KCRHA, the King County Regional Homelessness Authority. And once I have that, I'll be ready to do stuff like that. But yeah, we can get together sometime. Thanks.
Excellent. Thank you.
Okay, any other discussion? Hearing none. All those in favor, say aye.
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 Any opposed?
Mike D, no, I'm voting no. Thank you.
Very well. With that, it does sound like it is the ayes have it. Congratulations, Chair Pro Tem Ross. You can take it from here.
All right, well, thank you. So welcome, everybody. I'm now going to call this regular meeting of the KCRHA Implementation Board to order. We start by grounding our work in our theory of change, which is if we create a homeless response system that centers people with lived experience, then we'll be able to focus on responding to needs and eliminating inequities in order to end homelessness for all. This is a hybrid meeting, as all of our meetings are, so there is a physical location as well as a virtual access. Our in-person location is at the University branch of the Seattle Public Library. I'd like to also kick us off with our land acknowledgement. We acknowledge that the King County is located on the unceded traditional land of the Coastal Salish people. We honor this land and its people, past and present, and we are committed to directing funding and resources to organizations led by and in support of Native Indigenous people. We also have public comment today, and each member of the public gets 2 minutes. If you are in Zoom, please raise your hand now, and our clerk, Austin, will call on you when it's in order for you to be received. And if you're in person, please connect with Catherine, who I believe is at the physical location, to sign up to get your name on that list. So we're going to move now to the consent agenda, where we have 3 items. We have our May 24th regular meeting minutes that we need to approve, our May 10th special meeting minutes, and our May 28th special meeting minutes. Is there a motion to approve our consent of these agendas?
I make a motion to approve the consent agenda.
Gordon McHenry seconds.
And we are open for comments. Mike D, I see you have your hand up.
Yeah, I wanted to motion to table the minutes since we just got them and haven't had adequate time to review them. And they were just made available for the public for all 3 meetings. Thank you.
For those, do we have a second on that motion to table the vote? Not hearing any, then do I have a motion to approve?
The motion's already approved. We can move over to a voice vote.
I have more discussion.
Okay. Recognizing Mike D.
Thank you. I was there at the May 8th meeting. I did attend late. I gave my reasoning for attending late, that I felt that it was a 1 p.m. start meeting and I would not be there till 2 p.m. because that's the regular time for the meeting. And I was concerned that it was not noticed as a special meeting and I didn't want to be in violation of the OPMA, Open Public Meetings Act. And so I did show up shortly after 2. Thank you. And I made it to the executive sessions. Thank you.
Thank you for those comments. Any other comments? Okay, so.
Sorry, Christopher, I was wondering actually, a question for Mike. Mike D, given that, was he asking to amend the minutes to note his attendance? I wasn't sure if that was the.
Sure. Mike D, motion to attend the minutes to note my attendance and objection to having interviews in executive session that I felt should have been done in public. Thank you.
I recognize modifying the minutes to reflect that you showed up at a different time. I think it's a different thing to make comment about what transpired in the executive session, though.
Understood.
Okay. So with that amendment, so Austin, we still have you on. Can we make that amendment to the minutes?
Yes, if there's a second, and then we do a quick voice vote. Yes.
Okay. Do I have?
I'll second it, Ben.
Thank you. Keisha, I see that you have your hand up.
Yeah, sorry, I was out. It's kind of hard to hear, but I wanted to support Mike D's motion. Sorry about that.
Okay, Chair, you can move to a voice vote with the amendment. Unless further discussion.
The amendment to modify Mike
The
D's
minutes.
sentence or the minute. Okay. So, but we have.
Yeah.
I'll move to a voice vote then. All those in favor, say aye.
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 Opposed? The ayes have it.
For the record, Mike D, I'm abstaining on this.
Thank you, Mike.
And then, Chair, now we move to the original motion to approve the consent agenda. And
Thanks
that can be via voice vote unless there's any other discussion.
Thank you so much, Austin. Do we have any additional discussion or can we go ahead and move forward to a voice? Hearing none. So can I get a approval of yay if you agree to approve the agendas?
Yay.
Yeah.
Yeah.
Do I have any opposed?
Mike D, I approve the amendment. I oppose the passage of them at this time. Thanks.
Thank you, Mike. Any other? Sounds like the yeas have it, so it passes. With that, I believe we can move forward to public comments. So we now move on to, beg your pardon?
Nope, that's correct.
We now move on to public comments, which will be for about 15 minutes. If you were not able to raise your hand or sign up, please do so now. We would like to remind people to please provide public comments, to keep your comments to the agenda items, and each speaker will receive 2 minutes. Austin, would you please open the public comments and call on folks in the order that you received their request?
Absolutely. May I first ask Catherine Todd, who's at University Branch at SPL, is there anybody in attendance to provide public comment? Catherine?
She's showing on mute.
As we, yes, Catherine, you are muted. We will come back to Catherine. We'll just jump on over to Zoom. Mike Mathias is up first. Mike Mathias, you've been given permission to talk. If you would like to unmute, test your mic, and then after that, your 2 minutes will begin.
Okay. Can you hear me okay?
Yes, I can, Mike.
I've got a little comment here that says I'm being promoted to a panelist. I'm assuming I do not want to do that, correct?
No, you do not want to do that. That is
Go
correct.
ahead and close out of that, and I'll get going. Hello.
Thank you,
I'm here. Yeah, no problem. I'm here to request the attention of this board to one of the responsibilities of this board, which is ensuring that the KCRHA carries out its duties effectively and transparently. In May 2005, our organization, Anything Helps, applied for HMIS access, and that request was denied. Believe that the KCRHA had every right to make that denial. We also had every right to appeal that denial, which was actually successful after a vote by the Systems Performance Committee. But we were still denied with no policy or precedent for that denial, and then instructed to wait a year before reapplying. We have now waited that year for the reapplication, submitted our application, and yet we have not received any response for our second request for HMIS access. This access is crucial for our organization's ability to track and support individuals experiencing homelessness effectively. The prolonged lack of response from the KCRHA on this matter is not only hindering our operations as an organization, but it's also impacting the lives of those that we currently serve. So I urge the implementation board to intervene in some way and ensure that our application for HMIS access is promptly reviewed and equitably addressed. Your action will demonstrate the KCRHA's commitment to accountability in collaboration with community partners dedicated to ending homelessness. I really appreciate your time and thank you for hearing me.
Thank you, Mike. We now move over to Tamara Bauman. Tamara, you've been given permission to speak. If you want to unmute, test your mic, then your 2 minutes will begin after that.
Okay, great. Can you hear me?
I can.
All right, thank you. My name is Tamara, and I am here to straight up question your ability to govern responsibly. Rather than embrace community wisdom, you double down on policies and so-called leadership practices that do not work and only continue to harm both our unhoused and our housed neighbors. Dare I say that some of you do not want to change the system and in fact are invested in maintaining status quo policies that reinforce the industrialization of homelessness. The IB and GC are solely responsible for the media chaos and dysfunction at KCRHA. As a community member and COC board member, I want to draw the public's attention to the irrefutable fact that both entities have willfully ignored the founding legislation that created KCRHA. Is it any wonder why so many of KCRHA's original staff have fled the organization and that the remaining staff have had to unionize for their own protection? I am personally devastated by the loss of so many amazing employees who genuinely wanted to see community transformation, but were pushed out by the arrogance and poor leadership embedded within KCRHA's governance structure. At the May 28th special meeting, I heard a bunch of fluff about supporting the staff and changing the toxic work culture of the organization. But let's be real. The city of Seattle and King County have created and continue to benefit from the imbalance of power between these boards and the rest of KCRHA, including the COC and larger community. It is abundantly clear to me that the current governance structure at KCRHA is not conducive to achieving liberation for our communities, at least not in partnership with the COC, who shares the responsibility of caring for our communities. That is a clear demonstration of power hoarding and disrespectful towards folks with lived and living experience. I believe the members of the IBNGC don't want to change the system because the power differential preserves the practice of excluding the voices of those with lived and living experience in favor of those who view housing as a commodity and a privilege, as opposed to the human right that it is. Let me be clear. No one wants to see our neighbors suffering on the streets. We don't have to agree on why, but if we're serious about addressing a humanitarian crisis, then we do have to acknowledge
Thank
that
you,
homelessness
Tamara.
is a result of
Thank you.
nonsensical public
Your 2
policy,
minutes is up. Thank
politicians,
you.
power hoarding.
Thank you. I was just notified that we do not have people at University Public Library. Next up we have is John Grant. John, you've been given permission to speak. If you want to unmute, test your mic, then your 2 minutes will begin after that.
Good afternoon, Implementation Board members. My name is John Grant, and I'm the Chief Strategy Officer for the Low-Income Housing Institute, which is a member of the Seattle-King County Coalition on Homelessness. I'm testifying today to encourage this body to recommend to the Governing Committee the stabilization budget proposal that prevents the loss of hundreds of shelter beds and related homeless services. Our organization would be deeply impacted by these cuts. KCRHA initially recommended an additional $1.5 million to replace expiring funds to our Tiny House Village program in Seattle. We request this addition to be included in the budget proposal to ensure we do not have up to 3 tiny house villages closed next year. That would constitute the loss of 136 tiny houses, or 29% of the available tiny houses we operate, which would mean sheltering up to 600 fewer homeless people next year. We also request that funding be included for the 2 tiny house villages in Tukwila, which also have funding that expires at the end of this year. These programs have been crucial resources for those communities, as Tukwila has been the focal point of asylum seeker arrivals in our community in need of shelter and housing. We need these programs more than ever next year. We support the original budget proposal to add an additional tiny house village in 2024 and ask that those funds be added back in the budget. Now is not the time to roll back shelter funding. Please act to raise the bar for the Governing Committee decision makers so they are starting from a floor and not a ceiling on funding levels. Thank you for your time.
Thank you, John. Next up we have is Ruby Tuesday Romero. Ruby, you've been given permission to speak. If you want to unmute, test your mic, then your 2 minutes will begin after that.
All right, testing. Testing?
Yep. Hi, Ruby.
Okay, cool. Thanks. Hello. Thank you for hearing us today. I just wanted to underline all the comments I've heard previously, and wanted to also offer the opportunity to join the cross-cutting policy work group on the COC committee, or a committee with the COC board, the Continuum of Care board. And I just encourage anyone from the implementation board or governing committee that might be listening that could be interested in getting to these solutions and really working hard on the minutia of how this all goes down. And I think that we can really collaborate and make some effective change if we listen to each other and are willing to sit down at the table. And as I see that there's been a lot more increase in between the implementation board and the Continuum of Care. So I just want to say thank you guys for that. But I just wanted to encourage, if you're interested, I'm going to send out the scope of work, and hopefully we can get to work on this together. As a COC board member, I'd really appreciate getting to know my colleagues. So thank you. I yield back.
Thank you, Ruby. Next up we have is Michelle Eastman. Michelle, if you'd like to, you've been given permission to speak. If you want to test your mic, then your 2 minutes will begin after that. Michelle Eastman?
Yes, sorry, my mouse wasn't working for a minute. Can you hear me?
Hey, it happens to the best of us. I can hear you.
Wonderful. Okay, so my name is Michelle Eastman. I'm the Director of Communications for the Lived Experience Coalition. and I'm here today to urge the board to update the operational work plan so that it addresses the staffing vacancies and staffing necessary to carry out the work plan, the operational work plan. These pieces are essential to me helping the work plan succeed. I am also here to urge the adopting of a multiple touch rule on important documents requiring board approval. The board needs time for reviewing documents to make sure that it can include necessary items, such as the budget, for example. And then having multiple touches allows for materials to be reviewed, time to go back for the members to go back to their constituencies, and for questions to be asked, as well as changes to be made before finalizing. For this reason, I would urge the board to go to implement a multiple touch rule. For these reasons, I would urge the board to implement the multiple touch rule. Thank you so much for your time.
Thank you, Michelle. Last one that signed up on Zoom is Bill Curlin-Hackett. Bill, you've been given permission to speak. If you want to unmute, test your mic, and your 2 minutes will begin after that.
Testing. Is that good?
Hi, Bill. I hear you.
Thank you. Well, I signed in late. I'm glad I caught the public comment. Bill Curlin-Hackett, Interfaith Task Force on Homelessness. With a colleague from the Tacoma Pierce Coalition on Homelessness, we're inaugurating a revival of efforts to do safe parking at faith communities, starting in Federal Way, July 11th, with 30 congregations. I've noticed that the 5-year plan has RV safe parking and has safe parking. To my knowledge, and in conversation with Sparrow Carlson, there really isn't any safe parking in the city that's funded by either RHA or the city of Seattle that is not just dedicated to RVs. We will be including RVs at faith community lots. I'd like to talk more to the implementation board and specifically to staff. I know I have an appointment in 8 days with the new interim CEO, Heather McClendon, but we really need to get safe parking going to get people off the streets and out of harm's way. Impounds are multiplying, harm is escalating, and faith communities, many of whom are ready to help, can help without added cost. What we will need are pathways into housing. In other words, housing navigators, people who can begin to bring people into HMIS if that's necessary. In some cases, it might not be. But it needs to be a stream, a pathway from just safe parking into housing. So the conversations have not been happening through RHA. They're not happening through the city. The Vehicle Residency Work Group is independent, floating on its own. This is untenable to me when the 5-year plan asks for RV safe lots and safe parking. And we used to have a Vehicle Residency Work Group under RHA. So you folks need to put your heads together and decide what it is you want, and if you want people who know what's going on to guide you or not. So we're working with your regional coordinators, with Mallory, with Abby, and with Sparrow, but we need some executive decision making. Thanks.
Thank you, Bill. I'm gonna ask 2 more times if there's anybody else who would like to speak. Is there anybody else that would like to speak? Is there anybody else that would like to speak? Seeing none, Chair, public comment is now closed. It is back to you.
Thank you. Thank you for the comments. So we now move on to our only one business item, which is a review of the operational work plan. And presenting on this is Jeff Sims, our Senior Director for Policy at the KCRHA. Jeff, I'm going to hand the floor over to you.
Thank you, Member Ross. I'm going to share a
Bingo.
move a few things around so I can see you all better. I'm being prompted to turn on subtitles. Mr. Clerk, I should do that, correct? Austin.
I believe Austin stepped off. If you can turn on subtitles, that would be fine.
Oh, now I'm getting some. All right. Hopefully that works. Yeah, there we go. It is capturing things, and hopefully that's improving accessibility too. Thank you for letting me be here today, members of this board. I'll dive right into the matter at hand, which we have discussed previously. You'll remember back, I believe it was in April, I was here just highlighting for you that the governing committee passed resolution 2023-04, requiring the KCRHA put together this document that we're bringing to you for consideration today, which we call the Operational Workplan. There are a variety of components that were listed as the things that KCRHA needed to provide as reports for our board members and for the boards through the operational work plan. You can see those listed here. All of those are met and provided and discussed in what is has been provided to you. And so this was the timeline that was done on. On May 6th is when you actually received the first draft of this. I was transmitted both to the implementation board and the governing committee and their staff, if that was applicable. Today, obviously, we are bringing it to you as the board. You received another updated copy with the edits that were requested by the IB's System Planning Committee. So that was what you received last week. And mostly the changes actually were only on the very beginning, clarifying what a vote on this means and adding a little bit more introductory material. And then also making sure, I think I changed the phrasing around what a green dot on the 5-year plan meant. Just to be very clear, I added a key basically. But otherwise it was largely unchanged. Assuming that you all take a vote today, it would move to the governing committee where they, per the resolution, would vote on it and after discussing it at their July 18th meeting. I want to make sure it's clear what we are asking you to do today. If you do want to take a vote, obviously, all members of this board are aware that we have continuing, we have obviously not brought an end to homelessness. We have an increase if you look at our recent PIT numbers that came out. What you're voting on here is to acknowledge that the updates that were provided, that you're fully aware of the update and that we're providing this as requested, that the submission we are providing meets the requirements of what was laid out for us. My assertion for you, though obviously you've had a chance to review, is that all items are covered. I haven't received any feedback indicating that anyone has a different opinion of that. And then you're allowing us to proceed with providing this update to the governing committee for them also to take action on. So that's what your vote is today. It might not be that you like one of the items. For example, I'll dive into some of the funding, for example, that we are in the status of awarding, but rather that you have been actually given the update, you are aware of it, and that we have met the reporting requirements laid out. With that, I want to stop and just make sure that there's no questions before I dive into the actual highlights of the plan. Member D.
Howdy, Mike D here. Thank you. I got my email after that May 6th date, so I didn't get the early copy of this, and I'm not sure if there's other documents that y'all need to get me for this or for my work here. But it looks like the intent of this is to be a quarterly report. Do we know what needs to happen for that to happen?
The idea is that a quarterly update will be provided after submitting this. And the way the resolution is phrased, this is actually a point of clarification when it was passed too, is that the updates will be as appropriate. So for example, there's some, this current plan talks about some new funding that was provided last year. It was awarded, recompeted, has been operating for a while. We're not going to keep reporting that to you every quarter. We're just going to move on and talk about places that there's new updates. So it might not be quite as wide in span, but otherwise, yes, we are required to continue providing this kind of an update each quarter.
All right, thank you. And the resolution asked for us to approve this 6 months after, and we're past the 6-month date, and the governing committee will be past the 6-month date. So
the resolution asks for, requires RHA to provide a draft of it to our boards within 6 months. We did meet that. That was by May 6th. Actually, we had a little fungibility. The resolution wasn't signed for another 5 days. We weren't going to take advantage of that. We just wanted to get it to you on a timely basis. So we did meet the 6-month requirement to provide it to you. There's not a timeline that is required of you, of this board. You can take multiple meetings. I know that was a comment that one of the public commenters made about having multiple touch points on it. There is a timeline that's laid out for the governing committee. Once this group takes vote on the operational work plan, providing it to the governing committee, they have to meet and discuss at their next meeting.
Okay, I'll hold off more questions till after your presentation. Thank you.
For sure. With that, then I'm going to go through some of the highlights. First, actually, one of them is I started to allude to new funding. We have awarded, and I believe all of it. Sorry, I'm not able to see my notes on the side now that I'm in a presentation mode. So I have the exact listing of each thing. We have awarded, I believe, all of the funding that was provided to us in 2023, with the exception of some that was actually not feasible to award due to city statutory code. And so that funding was reallocated for other purposes, and we're still waiting on further legal guidance there. One item that I in particular want to highlight, there are some projects that we have made the award, but they are not yet operating. And one of those is some new safe parking programs that are both to, and this is to the public comment from Bill, both RVs and vehicles. At this time, the awarded agency, the Low Income Housing Institute, is still looking for a location to stand up that parking program. The initial lot that they had proposed has run into some challenges. They're having to look for a new site. Otherwise, all the details on each of those is provided. And after I stop putting my screen on sharing the presentation, I'm happy to go through in detail on any of those if you want me to. Our next item, contracts. You all have had this presented a couple of times before. It deserves lauding again. KCRHA had all of our renewals done in January 2024, so that all agencies were able to submit their invoices on time. It was a dramatic improvement, not only compared to our work in prior years, but also compared to the majority of our government partners, many of whom were substantially behind us comparatively. So I think it should be lauded that we did get that done and continue to have that as our benchmark for success. On one-time funding, this is very similar to a discussion that we've had recently around what was first the stability budget request and then an amended request to align with the direction that the city of Seattle has provided KCRHA. As you see here at this time, I can't say with certainty about the impacts that would occur. The city has now received the revised budget proposal that this board passed. We understand that would likely have some impacts, though obviously we'd seek to minimize program impacts to the degree possible. And it's going to be up to the mayor and the Seattle City Council to take action on those funding processes. And I know there's a public commenter on that piece as well, related to tiny home villages. The next item, at this point, we are continuing to be paused on doing a procurement of all of our contracts. That was until we have a new chief executive officer. Obviously, that person's been selected. She has not yet started, and I assume there'll be some amount of time until she is fully up to speed and engaged in the process before we move forward. So you should not be expecting, the posting of a competitive announcement or anything like that in the interim. I wanted to pause because that's I'll do one more because and then we can, before I go to the next slide. On the ombuds, this board actually received a presentation from Katara Jordan, our chief ombud officer, a few months ago. So I can't recall the exact date. So that presentation went into a lot of details, which are linked to from this report, and I believe maybe also attached. But we didn't restate all of that information. So those first 5 bullets alone are a lot. And I want to just pause and see if there's any questions or comments at this point. Okay, I'm not able to see anyone raising their hand. Mr. Chair, is that correct?
Mike D has his hand up.
Okay, thank you.
Yeah.
Thank you. Just real quick, are you able to say what the safe lot that was proposed was so the public can know that that was tried and is no longer available?
Yeah, I don't know the exact address of it, so I can't do that. But it's WashDOT property near a location that the right-of-way initiative had resolved. It wasn't actually the same spot, but nearby. And it was actually a variety of land use, contracting, state requirements around how you proceed with utilizing their land, things like that. It's not actually a forever off the board, no, but just the process in order to utilize that property is much longer than other options that Lehigh is currently exploring.
Great, thank you.
Mm-hmm. Member McHenry, I see you have your hand up too.
Yeah, hi, Jeff. Quick question, and maybe I just didn't hear, but with regard to the third bullet, one-time funding, City of Seattle budgets, is the timing of that like in the fall that we'll have clarity, or yeah, maybe let me ask it this way: when will we have clarity on that one-time funding in terms of timing?
That's a great question. The mayor of Seattle releases his budget at the end of September. Something of this magnitude, obviously, like it's a large amount of money, so that would have a large, like, that might adjust our sense of the direction we're going if funding for these types of programs is included or not. And then the city council won't actually adopt their final budget until the end of November. It's usually right the last week before Thanksgiving. So that's when we would have, and that's not, they actually have a little bit of flexibility to be a week or two after that, but usually that's when it occurs and when we would thus have true clarity and certainty. In the city council process, they frequently have either a package that goes through committee, or they might call it like a balancing package. So usually before that, we have a good sense of where things are headed. It's just not until the appropriations are appropriated, it's not official.
Understood. Thank you for the clarification.
For sure. Member Reddy?
Hey, thanks, Jeff. Actually, it's similar to Gordon's question. This budget process is pretty iterative, and I'm wondering if there is a benefit to our passing or requesting or passing a resolution asking for the city and the county to make up that difference in one-time funding, the difference between essentially the budget that we passed and in which we indicated that it would lead to a loss of significant numbers of shelter beds, and the stabilization budget that we had heard of before. Like, what role do we have to play in that? Like, we have sort of notified them that in being in line with the budget that we had, and the funding that we've been provided would lead to significant cuts. Can make an additional budget request to make a difference here?
I don't think that it would be a little out of order to make an additional budget request at this point. Our instructions from the city and county required a submission by June 3rd. I do think that there's likely benefit, if nothing else, just providing clarity that the board, although choosing to comply with the guidance provided to KCRHA, made it clear that the preference would have been the stability budget and the action you took by resolution. And then, as is the case with all boards, you always have your role is always obviously to be emissaries to the community about the workings of KCRHA and the issues that we're facing. So I think it'd be appropriate for board members to engage as such, having adopted a resolution that speaks to the need to have the stability budget and that funding and preserving those programs.
Thank you, Jeff. I did have one other question, but in case there's anybody else, I want to defer to them first.
Okay. We'll come back to you then. Member Moritz, I believe you're second.
Sure. So, Jeff, firstly, thank you for preparing this report. It's really fascinating stuff. I dove into it quite deeply, and I encourage everybody else to read through it as well. I don't know how many slides you have here in terms of how deep you're going to get into the work that you did, but I very much appreciate this and think it's something that we should be doing quite regularly going forward, just so that we can see both the great work that's been done as well as the challenges that are to face. I don't want to skip ahead too much, but since we're talking about the fiscal cliff and the funding issues, I just want to ask a direct question. In the depth of the report, it mentions that we went from 5,198 temporary shelter units last year to 4,995 this year. So a pretty substantial drop of about 200 units of shelter. Do you have a view as to how much that number will change this year with existing funding restrictions that we have, or programs are ending this year, as well as next year with the budget that we've approved? That if we have 4,995 today, how many will we have at the end of this year? how many will we have at the end of next year?
That's a great question. So some of that requires some prognostication that I can't do with reliability. But overall, as we highlighted in our prior materials, we would see there was 3 main areas that we highlighted as a concern. The first was a $5.9 million group of programs that have been funded since September of 2020 with successive rounds of one-time funds. That could be as many as 300 shelter beds that could be impacted, as well as it's a diversion program. So we just use the caseload to get that they had in a recent year of 265 households that wouldn't have their homelessness diverted. So that's the first potential impact.
Sorry, what is the timing? What is the timing of that?
That'd be December 31st, January 1st was when the funding would run out to those degrees.
Thank you.
Sure. And then similarly, and there was a public commenter from Lehigh that mentioned this, there is a pool of funding that was one-time funds provided for tiny home village operations. In 2023, that amount of money was $2.5 million. They used it to provide behavioral health services and staffing. That amount was requested to continue. The city of Seattle provided $1 million, not $2.5 million. So there's already a reduction in services this year to some degree. And then next year you would see $500,000 of that $1 million go away as well, because there's one-time funding. So there's a degree of further impact there. It's very difficult to know what that impact would be at this time, just because we've got so many stages of reduction. And then the last piece is a shelter that serves Black men experiencing homelessness. And it would be nearly half of its funding would be in jeopardy. It's difficult to tell exactly what the impact on those operations would be. That level of a reduction can be exceptionally destabilizing to the point that a program might not be able to function. Though at the same time, it's a large budget. So I hope that what we would find if that were realized is that there would be a reduction in beds, but not a closing of the program. With all of these, I want to emphasize that to the—
Yep, excuse me, this is Jaja. Can you, do we have new funding, or since that funding has been reduced, is there something to replace that yet, or no?
No, not at this time. So that actually, Jaja, thank you for raising that point though, because it's really important. That's why the slide says to be determined. The City of Seattle's budget process is not complete at this time. It is not clear that that funding cliff, which we had to highlight, that is the requirement of the resolution given to us. But it is not clear that that funding cliff will be realized. We certainly hope it will not. And you as board members expressed that desire as well. So, you know, all of these are to be determined at this stage. Member Mertz, to your other question, Daniel, are you on? Daniel Ramos? Daniel's on our community impact team and actually handles our housing inventory count and a lot of pieces of the point in time count. And he could give a little bit more detail on what happened with the variation in the number of beds that we have. It might be able to give granularity on that. There's a lot of details and nuance under it that I don't know. So we might have to follow up with you, Member Moritz, to give some more detail to answer your question.
Okay, yeah, and I saw that we're getting close to the real-time inventory tracker, which I think is going to be hugely helpful for policymakers and the broader community to understand how we're doing. I do think that it's not all doom and gloom, right? The increase in the number of PSH units that we've been able to do over the last year is truly staggering, going from about 8,000 to 10,000 homes in just 1 year. Opening 2,000 PSH units in a year is I mean, it's just dumbfounding that that's possible to do. I say that as a real estate developer. So I know that KCRHA is a piece of that, and there's many other funders and service providers involved, but as a system, we should really celebrate that. But you know, ultimately, our number one goal as a authority is to reduce unsheltered homelessness, and the only way that we can do that in the immediate term is by creating more shelter inventory and certainly preserving what we have. So I'd love to have more follow-up discussions about shelter inventory, as well as starting to talk about what we can do or can't do in the context of this funding cliff. So if that means that we have to do more with less, then we got to figure out how to do that, whether it means reallocating resources, trying to change our shelter typology to maintain inventory, because it is very clear that every single shelter that we close is going to result in, exactly one more person becoming unsheltered homeless in our community, and that is something that we should not be tolerating.
I would addend that to say likely more than one. Many of our programs do not have someone stay. Most of our programs don't have someone stay for a full year.
At least one. How's that?
That'd be great. Let's see. Member D, I think you were next. I'm sorry, I'm having trouble tracking the order.
No problem. Thank you. Since these were with one-time funds, it's not necessarily expected that they'll be funded after that. But looking at what they were funding, it looks like we would want to consider maybe moving stuff around depending on how that works. At the last is there a budget committee for the implementation board working on this? Are they getting updates and presentations from these groups and stuff?
Actually, I believe all of the budget, so RHA is similar in timing to many city departments, where our budget proposal has to go to the respective executives, so the county executive and the city of Seattle's mayor, pretty early on, so that executive is able to analyze all of the different strains on the funding available to them and make some decisions and then release them by September. So our work was completed in the spring primarily. The vote on that took place, I believe you took before you joined the board, member D. So at this point, the budget committee is not continuing to meet, and we've had to make our submission. I know that, especially as a new board member, I'll point out, I recognize fully that to say we're asking for next year's money when we're only a couple months into the current year seems crazy, but it is pretty standard in how government works. I've worked in various government budget functions for more than a decade. So that round has already passed. And then to your question about other funding being available or moving things around, RHA is again limited in what we are able to spend by what we receive. And that we don't have some pot of funding that is allocated to us as flexible funding to meet needs as we see fit. Rather, all of it is earmarked for a specific thing. So to address these kind of one-time needs means we have to not spend it on something else. There's not the ability to address these without increased resources from our funders.
Thank you. Yeah, I was on the committee. I'm sorry, not on the committee. I was a board member. This vote was taken last meeting between the 1 to 2 p.m. time. And so that was when I wasn't there. But since there's a potential lawsuit pending, is it possible that we're going to have to revisit that budget if that meeting's found null and void?
I'm not aware of the lawsuit you're referring to, but I am aware of the notification requirements that I understand were met related to Open Public Meeting Act requirements. So I don't believe, I wouldn't anticipate, I guess I'm not a lawyer, so I won't find more. I'm not aware of any reason that we would need to revisit the vote at this time.
Okay, thank you. And is the work plan and the budget sometimes done together so that you can compare stuff?
In this case, the work plan, this is actually the first time we've had this as a document. We've gone through a budget process multiple times, but this is a report that was asked by the governing committee of KCRHA. So this is the first time we're going through this process. It is, as was noted earlier, expected that we provide quarterly updates on things that have changed and updated. So I think there'll be a continued parallel conversation or concurrent conversation about both.
Great, thanks.
Member McHenry?
No questions for me.
Thank you. It's still up. I think it's
number one.
Thank you. Hi, Jeff. Thank you for all the work that you and your team have put into this report and for the time you're taking to answer questions. I really appreciate it. And I know we haven't met before, so nice to meet you in this context. I recognize that given the funding cliff that's coming up, or hopefully won't be coming up, and given the sort of up until recent ambiguity about the CEO search, it may be hard to think about what you would do with extra money and extra opportunities to move forward. But I'm curious in particular about what you view as the barriers to expanding temporary shelter. And I'm curious to understand if you feel that the siting process is such that if you were given extra resources to expand temporary shelter right now, you'd be able to do it, or whether even with financial resources, there would still be delays related to siting and finding locations to stand up temporary shelter that would need to be addressed in order for that money to be put to best use.
Mm-hmm. That's a great question. There's recurrent Seattle Times articles, for example, that will talk about some unused units that are sitting around. And the piece of that article that's usually left out is that we can't operate a shelter without the money to operate a shelter. So it's not just the capital cost to stand up. It is absolutely having the resources first and foremost. And you hit on exactly the other primary challenge that we encounter, which is a place to locate a shelter. The process to, for example, to locate a village of micromodular units is pretty clearly laid out in the City of Seattle statutes, but we see in other jurisdictions there's pretty stringent requirements, sometimes even prohibitions on standing up, a shelter in large parts of a jurisdiction. So that makes it very difficult. You can look, for example, at this report. There's 2 projects that we have awarded, one to Catholic Community Services, one to the Low Income Housing Institute. Neither of them are operating yet. They've both been operated for a few months. Catholic Community Services has their property. They know where they're doing. It's actually adjacent to an existing program, but it's still taken a while to proceed through all of the requirements that they encountered. And with the Low Income Housing Institute, again, the property that they initially intended to utilize is state property. Because it is not housing, but instead shelter, they don't fall into some of the more expedited pathways for standing up or utilizing a property, and that is proven to be a barrier. So there are definitely challenges that come from regulation. That is not the only thing. Sometimes it's also just finding property that is suitable and doesn't have substantial community pushback, things like that.
I appreciate that. And I'll just reflect on that response briefly to say that I think it's incumbent upon us in our capacity as board members and on the governing committee and on state legislative partners to help clear away some of these barriers to siting so that when we have capital and operating dollars to allocate, which I hope we will in larger amounts than we do now, that this team can move quickly to stand up those sites and get people indoors. Thank you for the response, Jeff.
Mm-hmm. I don't see any other hands. I only have one more slide, so we can dive into more discussion in a minute. But I just wanted to, couldn't fit everything on one slide. So moving down the list of required items for us, one of them was to talk about our major initiatives. And there's some particularly we wanted to cover. This group, I believe, is familiar with our work in collaboration with funding from the State Department of Commerce and WSDOT for the resolution of encampments on state-owned property. To date, all of our resolutions have occurred within the boundaries of the City of Seattle. We've served, there's more than 380 people have been moved indoors. That's 90%, 89% is now outdated, of the people that we've encountered at these encampments actually being moved indoors, not displaced. And then a substantial number of them are already, and I don't have the number in front of me right now, are in permanent housing. That was the intentional design of our program, to put people in permanent housing with the resources we received and to allow our outreach agencies the time they need to engage with people, build the rapport and the relationships necessary to effectively connect people with the right resources. So that's a huge example. And I don't want to leave out, I'm not aware of another program in the country that reaches that level of success in actually moving encampment residents indoors. I've heard 70% is the next best. And I always thought getting an A was better than a C. So then securing funding to support wage increases, I want to give credit to especially the City of Seattle's mayor last year, who not only provided the funding that we asked for to maintain and also the City Council who acted on that, got to give everybody credit. Not only giving the funding we asked for inflationary increases, but also a further 2% increase, particularly to address wages at homeless service agencies. And then with Medicaid, there's some details provided there on where we're at with various steps of that process. I encourage you to look at that section. The highlight for me is that we've had an 87% success rate with our submissions. So if we're sending in a bill for $1, we're getting 87 cents of that back, or $100 and $87. That's a very good rate of return. It's above what I was part of some of the projections last summer when we were looking at that. That's better than we thought we were going to be achieving. And then, as Member Moritz noted before, we continue to move towards a process where we'll be able to provide real-time tracking of shelter and housing vacancies. That project is a data project that we hope will come to fruition this summer. And then last, with the 5-year plan, there's a lot. There's several pages. I'm sure you all noted a long appendix going through every single activity for the next 2 years and talking about what deliverable, the dates of that deliverable. The key thing I want to highlight there is that a green dot on that chart means that it is on track. Doesn't mean it's completed yet, but we might expect it to be completed this November, and everything we've done to date indicates that this November it will be completed on time. I'm pleased to say that 50 of the 54 activities are on track for their completion. And all of them would be before June of 2025. And the 4 that are not are all related to that system-wide reprocurement that, per the direction we've been given, we are putting on hold. So KCRHA is doing an exceptional job there. All of our 5-year plan is on track right now, except for places where we've been told, please pause this by our primary stakeholders. And then last but not least, when you look at the metrics associated with the 5-year plan, 6 of the 8 performance metrics went in the direction we want them to go. The 2 that did not, one of them, this actually was also mentioned earlier by Member Moritz, is increasing the number of shelter beds. We had a smaller number. And then the second one, there's actually 3 different levels looking at the rate that people return to homelessness at, I want to say it's 3, 6, and 12. I can't remember which one, but one of those 3 benchmarks, one of them we had more people returning to homelessness, whereas the other 2 it was fewer. So those were all positive as well. With that concludes all of the substance of the plan that we're submitting, and I'm happy to answer more questions if we have any. Member ready.
Jeff, thanks so much. Really appreciate the presentation and the hard work that went into putting this together. I wanted to had a question, but first I wanted to draw our attention to just so one of our 5-year plan metrics, if it's okay. The individuals exiting the permanent housing. So, just for the public, I think this is actually fairly important. This, using 2022 as a baseline. In 2022, 3,298 individuals successfully exited permanent housing, or 42% of all exits. In 2023, that was 4,051 individuals. So from 3,300 to 4,000. And that was 45% of all exits, a 3% absolute increase. I point this out, I want people, I'm hoping just that we can both see this number and the fact that the point in time count numbers increase significantly. And what this sort of points, at least my interpretation of this is that as a system, right, like a homeless crisis response system, we are running faster than ever, but we're falling further behind. More people are coming into homelessness because of our lack of affordable housing. And I just want us to sort of have that context that people are coming out into permanent housing, and at least to a greater degree than before. If I'm interpreting that correctly, Jeff.
You are. Thank you for highlighting that and giving that analysis. You're exactly right. there was a lot of coverage of how the pit count got worse. But when you look at these metrics, which are more under our control, because we aren't able, we only have the amount of resources that we receive. We're doing better with those by all of these metrics. We are utilizing our funds efficiently, and that's often lost in the public discourse, but these numbers show that that's what's occurring.
Like we somewhat help control the outflow of people from homelessness, but like don't control the inflow virtually at all. And it is a much bigger problem than, anyway, sorry, I'm not going to get on a high horse about anything. I did want to ask a question though about when we look at our 5-year plan sort of tasks, in there we talk a little bit about outreach, for example. And it's noted that those outreach contracts are going to be returning to the city of Seattle for administration. And, I will say that my strong feeling is that outreach funding should remain with KCRHA. I think we've been successfully employing them. And I think a crisis response system that does not have, management and control of the front door, so to speak, is going to be less successful. That being said, I don't really know what the analysis has been, and it may be that the city has a strong rationale for pulling those funds back. If they haven't done analysis, or if we haven't, I would like to see that, frankly. I would like to see, is the system going to be better off with outreach dollars back with the city or remaining with us?
I'm not aware of any analysis that I can point to or that RHA has developed that would indicate we should be returning our outreach contracts to another entity to operate. To the contrary, I highlighted this for the Seattle City Council back in March. After we already recompeted, there was a narrative initially that was errant, that KCRHA had said we didn't want to have these resources. That is not true. The communication that was pointed to was about new, different funding for a new and different purpose than what we had already been contracted for, not the outreach funds that we have received historically. And after recompeting the outreach contracts that we have had control over, the geographically oriented ones that aren't serving specific populations, we actually saw some improvements that made sense also, but the data showed a notable improvement in the rate that people worked with a homelessness outreach agency and entered permanent housing and entered shelter. And that makes sense if what you think about is the primary change we made is the way that those agencies are deployed. So it's geographic, it's always clear who's on lead for an encampment, and it's not going to be kind of piecemeal across the city. And also because people they're highly mobile, but not long distances. So if a person leaves an encampment at one place and ends up 4 blocks away, that same agency is retaining connection with them and able to continue the work that they've been doing. So we saw that with the recompetition we did of our homeless outreach contracts. That was data from the second half of 2023. I don't know what the current data would say to it, but those contracts are moving forward. I understand that, well, according to the City of Seattle's own website, they're posting the RFP or RFQ for those funds tomorrow. So we will see what kind of changes are being proposed and what kind of data perhaps that will point more greatly to some areas of inefficiency. But at this point in time, that's a question you'd have to direct to the City of Seattle.
Thank you, Jeff.
Member Watt?
I think Member Moritz was ahead of me.
Okay, Member Moritz. It might be a leftover hand.
Yeah, I was going to say, maybe I'll...
no, sorry, I had a hard time getting off of mute, but Ryan, please go ahead and I'll come after you.
Oh, sure. I just wanted to underscore what Member Reddy said, which is that KCRHA is swimming against a rising tide, and this this presentation has given me flashbacks to an earlier point in my career where I was part of the team that helped update the system performance measures at HUD, and so now seeing them here represented is bringing me back to those times. I want to again say to the members of this board and to the governing committee that we continue to have a responsibility to advocate for the housing abundance that we know will be necessary to drive reductions in inflow into homelessness so that the RHA can continue to do the critical work of meeting those folks who do unfortunately fall into homelessness where they are and getting them rapidly into housing. I also wanted to, Jeff, if you wouldn't mind sharing your screen one more time on those numbers, to make an observation about the returns to homelessness figures. At the 12-month and 24 mark, those returns are down in absolute terms. They are also, however, down even further as proportion of exits because the number of exits has gone up significantly over this year. So if I'm interpreting this correctly, not only are they going down in absolute terms, but they're going down even further in proportional terms relative to exits to permanent housing, because the team has been successful in increasing the number of exits to permanent housing. Is that a fair interpretation of what I'm seeing here, Jeff?
I believe it would be. Daniel from our community impact team is on the line. So Daniel, feel free to come on off mute and let us know if there's any concerns you'd have with that. I do not sit with this data enough to know where some nuances could be missed, so I don't want to misspeak.
Yeah, I wanted to point out because I think it tells an even more positive picture than what we're seeing. If we saw the same number of people, which we aren't, if we saw the same number of people exiting to permanent housing and a decrease in returns, that would be great. But given that we're seeing an increase in exits and a decrease in returns, I think that's doubly reason to be optimistic about the trends we're seeing here.
Yes, thank you, Member Watt. This is Daniel. I would agree. Thank you.
Member Meritz, go ahead.
Thanks. Sorry, so a couple of points here. One, we don't control the inflow that is generally driven by housing and supply and demand. We know that, particularly for affordable housing. We don't really control our funding to the greater extent, but we do have quite a bit of control over how we spend the funding. And I'm hearing general support, particularly from Simha and others, to try and make a strong case for why we need to maintain and increase funding levels. And I heard you say, Jeff, that we're being very efficient with how we spend our money, which is great. But I would like to challenge that we may need to, in this environment, get even more efficient and really look at the portfolio programs we have and figure out which are the ones that are most effective on a per bed or per dollar basis, down to the level of individual providers, program types, et cetera, so that if we are in a situation where our funding remains constrained, which is likely to be, we can do more with less. Simha, I'd like to invite you to work with me maybe on a resolution that we can do that would both address both things, both make sure that we are trying to understand the efficiency of our programs and managing our spend in the most effective way, as well as trying to seek additional funding for those most efficient program types, whatever they may be, such that we can make progress even against the rising tide. When you see numbers like this on this dashboard, then we also know that our PIC count has increased by 20% in the last 2 years. It's pretty clear that there are just a lot more people being pushed into homelessness, which is not terribly surprising given that we haven't really addressed any of the root cause. So I'm sensitive to the fact that we are facing a difficult time, but I don't think we can sit tight with our current program portfolio, which we all know that due to the delay of the system rebid is largely a portfolio that's existed for 4, 5, 6 or more years. We are in a different environment now where we have a much higher inflow, where we have constrained funding. We may need to shift what we're doing. So we can talk more offline about that, and maybe this is something we can talk about in the System Performance Committee or elsewhere. But I think over the course of the next few months, before we get into next year's detailed planning, we should really have a look at what can we do to increase the effectiveness of our spend. And connected to that is, Jeff, you mentioned that we've done a great job of allocating all of our funding from 23 and 24, but much of it hasn't been spent. There may be opportunities to recapture some of the underspend in certain programs and direct them to others. I know we have a lot of open positions at KCRHA, which is unfortunate, but that may also be an opportunity to take some of the underspend on administrative costs and put that towards programs that could drastically increase, or not drastically, significantly increase shelter in the immediate term and try and make it done.
Yeah, especially to that last point.
I do have a question.
Sorry.
Okay, I do also have a question, but it's an easier one.
Okay.
Go ahead and respond to that first if you want.
Oh, no, I was going to express agreement. Actually, the last 2 years, KCRHA has utilized the underspend that we realized to that pool of programs that's on the funding cliff to preserve those. That's the primary way that has occurred. And we continue, with all of the programs that have faced those kinds of losses of resources, that's the first place we've gone to. So that I just wanted to highlight unanimity in that viewpoint with you, or agreement. And then similarly with looking at efficiency and effectiveness, it really helped looking at how much we're spending on a program. Absolutely. I think that we've got a range of metrics that we are consistently looking at. So if you look, for example, some of our more expensive programs for a shelter, for example, the bed costs more because of the enhancement of services with that bed. And research and data have shown us that the successful exit of an individual from that bed into permanent housing is substantially higher. And so we're able to end homelessness for more people. And when you account for that greater throughput and more effective throughput that actually ends homelessness versus ending and a return to being homeless, there's that's a huge improvement. So having that breadth of analysis is really valuable, and we seek to do that, obviously, and our welcome conversations along those lines of how can we keep looking for further improvements, because as you said, we need to make sure we're always doing the best we can. I think you had a question, Member Moritz.
Yeah, my question was just on the one piece of revenue that we may control, which was the FCS reimbursements. It wasn't clear what the units on that page in your analysis were, whether it was totals or not. A lot of effort's been put into the FCS Medicaid reimbursement, and just curious to know where that was going and if it could be a meaningful funding source next year.
I don't know. I'm not able to speak to that particularly, and I don't have the staff with me that could go into that in more detail. So we'll have to follow up with you on that one. I do know that an important change that has occurred is that new enrollments in FCS have been paused by the Healthcare Authority. That does have an impact, especially on programs that are, building their funding stack for operating a new housing project might have depended on such enrollments, or for agencies maybe like in the outreach space that have a fair amount of churn. So that's an important change in what's been going on, but we'll have to follow up with greater detail and information for you on that. I'm just not equipped to be able to answer.
Okay, I certainly hope it's more than $9,000 in total reimbursement, but we will find out.
Member Ready?
I'm sorry, I just that caught my attention. Why is the Health Authority paused FCS enrollment? That's a fairly huge deal. There's a number of our providers who are trying to get into that space and figuring it out. And what the hell's going on? Sorry. But
I don't remember the exact phrasing of the announcement, but I believe it's something to ensure that their enrollment levels remain aligned with their funding, something along those lines.
Gotcha. Thanks, Jeff.
My understanding as well, both Ben and Sima, is that the process of submitting for this reimbursement is incredibly cumbersome and incredibly time intensive, and requires a lot of KCRHA staff, and has very specific requirements about what kinds of interactions between staff and clients are eligible for reimbursement. And my understanding as well, and I'd be happy to be corrected on this by Jeff or other members of the team, is that in order for that reimbursement process to be a little bit smoother, such that this could be a larger source of funding, we would need state administrative or potentially legislative changes to how this reimbursement process happens. Is that accurate?
At least partly it is. I can't speak as this is not the area that I'm most heavily involved in, but I know that part of our work has been precisely to address well, you are correct, have been manual processes in our billing, both in the exporting of data and then matching that to the billing system. And there have been some hurdles with that we haven't been able to overcome. So that is certainly that's actually one of the reasons that we are trying to do this small pilot, is to identify where those are and how we could propose improvements.
Do we still have that fellow from federal government here with us who's been working on specifically on Medicaid? Like, is he helping us draft a plan, I guess?
Yeah, I think that the challenge is that a lot of what we're looking at is going to be really domain to our state regulations around FCS and how that works. That program is available because of the waiver that the state of Washington has received for Medicaid. He's available, I believe, until the end of, I just got confirmation. He's available till the end of the month through the All Inside Initiative, which is a White House initiative, though it happens that the person you're referring to is also local and would still be available to us afterwards.
Thanks, Jeff.
Jeff, in respect of time, I see Mike D. Can I give you the last word on this? And I'd like to move to vote, so we have a little time for vote and comment. And just trying to respect everyone's time. I know that we have a few board members that have a hard stop at the bottom of the hour.
Thank you. Okay? Sure.
Yeah, thanks.
So you mentioned the all-ins or all-inside. That's a commitment that both King County and Seattle made a commitment to get 25% of the unsheltered people experiencing homelessness in by 2025. How does this plan reflect that, and how does our budget reflect that? Thanks.
I can't speak to the particulars of the All Inside Initiative and the specific goals that the city and the county made. We did not receive substantial new amounts of funding for new programs. The metrics that you gave didn't align with anything that I've heard discussed previously. I'll just note that. The majority of the funding, for example, if you look at this year's budget, KCRHA received a higher amount of funding than in many places, but the vast majority, actually, it might not be perfectly true because of one time, but all the money that we received that was new dollars were to preserve existing programs by providing an inflationary increase or money to address underpaid under low wages. So we don't have any new programs that'll be standing up this year. We didn't receive funding for any new programs this year. So I think that answers your question. I don't believe the metrics. We'll have to follow back up on what metrics were included in the All Inside Initiative, particularly.
Thank you.
So with that, if we can move on to the last order of business, we need to have a motion to approve. There's a resolution that was at the back of the packet. It's resolution 2024-12. And it is to specifically approve that we've seen and received this information, and we're going to share it then and advance it to the governing board. And so I need a motion to approve resolution 2024-12.
So moved.
Seconded.
Thank you. And then I believe we can open for comment or discussion. Mike D.
Thank you. I'm going to be voting no on this at this time. I agree with the community that we need more touches, and I would like to see a motion for a 3-touch rule in the future, that we see things at least 3 times before we vote on them, so we have a chance to go back to our constituents and get info back and forth with you all and make sure that we all understand what we're voting for, especially things like this where we're expected to plan, multiple months the rest of the year and look at what's been done in the past. Also, looking at there's been some changes in this stuff in the past of wording. You mentioned some of it, of what the metrics were, what we're mentioning, what we're talking about. Also, I didn't see anything about the organization chart and hear anything about, like, for example, the vacancies that we're dealing with. And I'm not seeing how the sub-regional planning is happening with meetings and activity in that area. Thanks.
Thank you, Member D. Any other comments? Seeing none, and we have a motion and a second. Can I do a voice count? A voice vote, rather. All those in favor of approving resolution 2024-12, say aye.
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 And
I
opposed?
abstain.
I'm sorry, that was.
Go ahead. Go ahead, Christopher.
No, thank you. That was, I want to confirm that was you, Member Floyd. And
Yes.
then abstain, or I have one from Jaja. And any motions to not approve?
Mike D, I vote on behalf of the people with lived experience. Sorry, on behalf of people currently experiencing homelessness in the lived experience block, I vote no.
Thank you. Then Austin, I believe you're on. It sounds like the ayes have it.
Yep, that's the opinion of the chair.
Okay. Ben, I saw your hand pop up for a moment. Did you have anything to add?
It's separate item, more of a good of the order thing, Christopher. I don't know
I
if
believe
that's appropriate now.
No, I believe that is. So it approves. So the motion, the resolution passes. The ayes have it. And before we adjourn, for the good of the order, comments and recognize Member Merritt's.
Thanks. Just two things. Firstly, Austin, can you confirm when our next meeting is?
Yeah, we are off in July. We are back in August. Let me get the exact date.
Great. Just wanted to confirm that we're off in July. Secondly, we have a new CEO joining us. Some of you may have heard. We're very excited about it, and I would like to propose that we form a small committee to help onboard her, which would include both just working with the staff to kind of make sure that the orientation goes well as kind of setting the expectations from the board for that CEO board interface, and helping to make sure we refine the job description as we move from the recruiting mode into the operational mode. We're hoping to get at least 5 members to be part of that to provide a bit of a cross section of our constituency groups. So if anybody would like to volunteer to join that committee, please let Jaja and I know. We'd like to move pretty quickly ahead of her August 1st start date.
Thank you.
We can follow up via email.
Chair Pro Tem.
Great idea.
Yes.
Point of information, it is August 14th.
Thank you.
Start date's August 14th. Is that what I heard?
No, that's the next IB meeting date.
Oh,
The
got it.
start
Okay.
date for Dr. Kennison is August 1st, I believe.
Excellent. Thank you.
Are there any other comments for the good of the order? Here, Member D.
Thank you. I just want to apologize to outgoing CEO Daryl Powell and what appears to be either a firing or let go or relieved of command or something. I'm not sure that went through the process that I felt it needed to, and it's a concern. So on behalf of the people who are currently experiencing homelessness and being their representative this time, I say I'm sorry and thanks for your service.
Member Merritt's.
Hey, sorry. So sorry to come back again. Mike, hearing you speak reminded me that we never did a proper introduction for you as part of joining our board. I don't know if you guys are all okay, since we have a little bit more time on our meeting. Would it maybe be okay with everybody, including our chair pro tem, if you just spend a few minutes telling us about yourself and where you come from?
I can do it next week for everybody since people got to go. Next meeting. That's cool.
It'll be in August then. But please do reach out
to
us. Let's talk before then.
Great, thank you.
All right, I now need a motion to adjourn.
So Mike D, motion to adjourn.
Then I'll second Mike. Gordon.
Okay. Can I? Okay.
Go ahead.
Motion to adjourn. No, I was just going to say about CEO Powell. I was not in on that conversation as far as whatever transpired, and I just want that to be on the record that I was not there, and so therefore I was not a part of that.
And with that, we are officially adjourned then.
Thank you, everybody.
Thank you.